In this video, we're going to go over documenting an evaluation. So our first step is going to be the Icd-10 codes. So we'll just do low back pain. And if you ever don't know which Icd-10 code to use, just type it in on Google and it'll come up. M5 4.5. Of course, now you have to add one to it. So we'll put that in. And then for simplicity, we'll do unspecific low back pain. And 4.50. So we'll say it's on both sides. Started a week ago. New injury. So in this section, we're just going to do like a brief overview. So Brett reports injuring, we're using his language, injuring his back last weekend when moving heavy tree logs from his yard. He bent forward and lifted a log that weighed about 50 pounds. When he did this, he felt a pop in his back and dropped the log. He went to urgent care where they performed an x-ray and found nothing wrong. He then saw his primary care, who prescribed muscle relaxers and PT. His back pain is about the same since the injury. So this is just a brief overview of from when the pain started to now. And then we're going to list the primary functional concerns in order of importance. So he works as an accountant, so we'll say sitting over 30 minutes. And then at this point, he needs a standing break. I like making these objective to make it easier to go back and measure to see if he's making progress. Bending forward past his knees. Say immediate pain. Lifting anything over 20 pounds. Odds are if progress is a little bit slower, to make it easier for the patient to notice progress, we're making this objective so that way we can say like, hey, you can sit 2 hours now before you can only sit for 30 minutes. So for these, unless he's limited prior, I'm just checking all these. And then just doing a brief note like, all right, maintaining body position, sitting, self-care, anything bending forward. Walking around's fine. We'll say carrying anything over 20 pounds. So we'll say pain location, low back, and we'll put in parentheses, denies buttock and leg symptoms. And then just worst, current, and best. Description, we'll say he says dull, achy. I just say we'll follow up in future appointments. And then aggravating factors. Sometimes I click these, sometimes I just say see above since we're doing this twice. Medical history, so he's in good health. We'll say he has high blood pressure. Imaging, x-rays, which were negative. No known things to affect it, so nothing on this list. Say moderate complexity since he has the high blood pressure. Prescription. Sometimes I say CE docs, or if it's just one or two, I'll just write it. Patient goals, no limitation with sitting. so he can perform normal work duties as an accountant, would like to return to lifting weights at local gym. Just basically, we asked them, most of the time they say, I'd like to decrease their pain as their goal. So I just asked, if we decrease your pain, what would you do differently? Or how would your life be different? So we'll do the low back profile. Patient consent, looks like no signs of distress. Some insurances we have to do this, like Medicare, Medicaid, anytime an authorization is required, and some others as well. So let's fill this out real quick. This is definitely one of the more tedious parts of a note. And then we're going to try to look at things that might relate to his functional complaint. So he mentioned sitting's hard and bending forward's hard. So we should look at his range of motion with lumbar flexion. So we'll say he's got 25 degrees. We'll also put in backwards bending, even though this doesn't really relate as much to his functional complaint. And we should also look at his hips. So if sitting's concerned, how much hip flexion does he have? We'll throw in some strength in there. If he had leg pain, I might look at these, but since it's isolated the back, I skipped it. And then the assessment, we'll say just a little, we'll start off with a breakdown, a summary of what happened, then list his functional complaints and any sort of objective finding that relates to it, and then maybe close with our overall diagnosis. So say pleasant 22-year-old male who presents to PT with low back pain that started a week ago with lifting a heavy tree trunk. Brett is currently limited functionally in his ability to sit for prolonged distances, or prolonged periods, which affects his work as an accountant. So that way the insurance company knows that this is important. Say Brett is also limited in his ability to bend forward and lift anything over 20 pounds, which limits his ability to perform household chores and participate in recreational weightlifting. Then we'll talk about our objective findings. So Brett presents with objective impairments in lumbar flexion as well as hip range of motion, which is affecting his sitting tolerance and ability to bend forward. Further, Brett presents with strength impairments, and the lumbar region also impairing his ability to lift over 20 pounds and tolerate prolonged positioning. And then we can just throw in like a TBC, treatment-based classification, or whatever you'd like to do for low back pain. So we'll say Brett's presentation is consistent with low back pain with mobility impairments. If he has some psychosocial issues such as anxiety with his work, we can throw in Brett also has anxiety, which may cause any sort of complications we want to mention with treatment, whether that's a delayed prognosis. And then I like to end it. Brett can benefit from skilled PT to achieve the goals outlined below. So it's a pretty simple case. And then I like to carry this over, but we just went over the exam findings with the patient, their home exercise program, self-management strategies, and the plan of care. They're going to be doing their home exercise program. And then under problem list, I just list their problems. So I start off with saying like low back pain. And then we're going back to what we mentioned earlier, sitting over 1 hour. I forget what it was we said. Lifting over 20 pounds, bending forward, past knees. So that way somebody looking at this can quickly, whether it's another PT, an insurance person, etc., can say like, all right, they're limited in these activities and know that PT is needed. Goals, always start off with independent with HEP. And then we're going to use this for our goals. We're going to use this for our goals and any sort of objective measure. So we can say sit over 4 hours without a break to tolerate work as an accountant. Say 6 weeks. No limitations with recreational weightlifting. Bend forward to toes without feeling limited, secondary to low back pain. And we can throw in some goals based off of our objective measures. So we can say over 40 degrees of lumbar flexion. We'll make this a 4-week goal. Say at least 5 minus out of 5 lumbar extension manual muscle tests. We can say we want them to have at least 120 degrees of hip flexion, and we'll say 40 degrees of hip internal rotation. If we think hip mobility is related to his functional impairments. And then later down the road, we can come back and say what percentage of these goals has he met. Frequency, we'll say 2 times a week for 6 weeks. Self-care, patient education, manual therapy, neuro-rehab, theractivity, exercise. I usually don't check these any further. I think just going under the box covers it. I don't do a lot of modalities, but if I do something like dry needling, I just put it for pain relief. And then billing.